my name is Katelyn Rodecap. I'm a public health nurse with the Defiance County Health Department. I am taking lead on communicable diseases. I just want to say welcome and thank you for your time. In doing this presentation, we wanted to take it back to basics and do a quick refresher on what's required by the state and explain how we get all of our data and what we do with it. First to review is, what are we reporting? This is the ABC Guide, which is a list of all the reportable diseases divided into 3 categories. The Ohio Revised Codes have deemed these diseases in particular as dangerous to public health because of their potential for epidemic spread. They're broken into 3 categories, A, B, and C. Class A is the most severe of the reportables, and these are reported immediately by phone. Even outside of business hours, for our county, you would still call the health department because for Defiance, the after-hour calls are routed to the sheriff's department, who then can get a hold of the health commissioner. Class B are less severe, and these are reportable by the end of the next business day, either by fax or entered electronically into the state system. This version is from 2019, which is the most updated, but still slightly outdated. There have been a couple of director's journal entries, specifically one on July 28th of 2022 that added Mpox, previously monkeypox, to the Class B list, and then one on March 6th of this year that changed COVID from being a Class A to a Class B, which changed how fast you have to report it. Class C then is not necessarily diseases that are reportable like a Class A or a Class B, but it's anything that can cause an outbreak. So like an RSV outbreak in a daycare, a norovirus outbreak in a nursing home, a lice outbreak at a day camp. And these are all reportable by the end of the next business day. As far as where to report, it always goes to the local health department where the patient resides. So if a Defiance resident goes to Toledo and is seen and tested, the results still come here. If someone from another county then is seen in Defiance, the record goes to their home county. If they are traveling out of state, records then get sent to their state's health department. So who? It's doing all this reporting. This will be healthcare providers and labs mostly that have knowledge of a case or a suspected case. As I said, they can be entered electronically into the state system, which is Ohio Disease Reporting System, or ODRS, or this paper form on the screen can be faxed to our secure fax line, and that number's at the bottom there. When filling this out, we ask that you just provide as much information as possible. Most often that gets skipped is the treatment category, if they were hospitalized or not, their pregnancy status, and if these are missed, we do have to follow up on those. To save time in the office, you can absolutely just fax us a face sheet with those demographics or contact information, a lab results sheet, and then just fill in whatever's missing from this sheet and just send us all 3. This is a very helpful resource that I just wanted to make sure that you are aware of. It's called the Infectious Disease Control Manual, or the IDCM, and it's on the Ohio Department of Health website. This is what the homepage looks like when you first pull it up. You can find the ABC's guide here as well as the reportable form, and then anything else that you could possibly want to know about these diseases. You just navigate through it by using the sections on the left. For instance, so this is section 1. This is just mostly quick links. You can get your ABC's guide here though. Section 2, these list out all of the Ohio administrative codes and revised codes that are applicable to the communicable diseases. So anything that explains and backs up why we do what we do. This can come in handy when a patient starts asking questions or maybe argues a point. When you click on a link, it will give you the full law, but also a handy official looking printable PDF version. For instance, if you click on isolation requirement, it would look like this. This has been very helpful to us in the past for educating employers and helping to enforce restrictions. For an example case scenario, let's say a daycare teacher tests positive for hepatitis A. This is a sensitive occupation with a diarrheal illness that's spread fecal to oral route. And let's say she calls the health department or her doctor's office saying, my boss is pressuring me to come back to work. They're threatening to fire me since I'm feeling better, and they're short-staffed. I was told that I needed to stay out of work for 10 days since the symptoms started, and it's only been 6. What do I do? So we can help them keep their job by printing this off and highlighting it like I did here, showing the related law and getting it to the employer. We can also help call the employer to help them understand the importance of them staying away from work, why we're doing this, but just having that official legal backup has proven very helpful to us. Section 3 is the one that I personally use the most. You have the option to click on any of the diseases to learn more about them. So for example, I spoke about Campylobacter earlier. So if I were to click on View Chapter for Campylobacter, and it brings you to this same homepage for every disease. On the right-hand side, you can download a very simple language handout fact sheet. It's great for giving out more information to a patient. And then clicking through each of the headings will give you everything that you're looking for, from symptoms to transmission to infectious periods, isolation requirements, anything like that. This last category of the headings is the one that we use the most. It's the public health management category. And this just has a lot of quick management actions. For instance, a daycare teacher is diagnosed with this and you can't remember if they should or shouldn't be off work, or if contact tracing needs to be done. That's all this section. On the right-hand side is those related laws, which is pretty handy as far as grabbing quick. Sections 4 and 5 don't really have anything useful, but section 6 then, these are common but not reportable diseases like RSV, herpes, hand, foot, and mouth. And when you click on these, they're just links to CDC sites that have more information. The last tab then is forms, and this is a quick way to grab that reportable form. It's actually the first one listed. It does have other forms though that we as the health department use a lot more frequently. For instance, since we'll stay on that Campylobacter disease, this is a document that's actually 15 pages long. This is the first 2 pages of it. There are certain positive labs that do require follow-up interviews to try and find the sources or try to make connections through. For example, if we have several positive cases of the same disease and they all ate at the same restaurant in Defiance, or they all swam at the same pool, then maybe we need to look into sending our environmental team out to do an inspection and some testing. Do they all happen to work at a chicken or a dairy farm? Then possibly the USDA needs to get involved. Have they traveled recently? Then we need to look into that area and see if they're dealing with any outbreaks. So this helps us gather a lot more data as we do surveillance on these diseases. All this data is then accumulated into these monthly reports that probably look familiar. These are distributed every month to not only the Board of Health, but we also send them out to our infection preventionists at the 3 hospitals, which they then disperse down to their providers, the directors of nursing at long-term care facilities, and Everside Clinic, just as we try to increase communication between all the healthcare entities in Defiance. The one that may look unfamiliar is the report on the left, and this is one specifically that we hand out to providers just to be an attempt to make a quicker summary that's easier to read for them. So thank you very much for your time. Again, my name is Katelyn Rodecap. I did list my email. If you think of any questions, please feel free to reach out. Absolutely. Thank you very much.